The nice thing about working in an environment where you have other teachers is that you can share the load. And so it's really important to engage your residency training committee to talk about how you will integrate communication skills both in your formal and informal curriculum. So having a plan is usually the first thing that I would recommend. In addition, and probably the simplest thing to do is observing your trainees. But if you're going to observe your trainees communicating, you have to have a framework by which to anchor your observations. So when I'm in a clinical scenario and I'm assessing somebody with neurologic weakness, then I have a framework by which to make that assessment. And in the same way, when I'm watching a trainee speaking, communicating with a patient, I have a framework by which I can observe their interactions, how they begin, how they gather information, how they incorporate the patient perspective, their body language, their nonverbal skills, how they provide information, how they close a session, how they structure their session, and how they build relationships. So a framework for communication skills is critical when you're observing trainees, and there are many that exist. The one that I like to use is the Calgary-Cambridge Observation Guide, developed by Dr. Kurtz and Silverman, but many others exist that have a very similar framework to what I've just described. And with that, you can choose to be with a trainee for 5 minutes and give them feedback on one specific area, or you may choose to watch their entire interaction and give them feedback from start to finish. There's no right or wrong either way, but observing with a structured framework is the best way. The next thing is that residents have to feel that this is not an add-on, that communication skills really is an integral skill. So having it in the formal curriculum, whether as a standalone, bringing the core skills to bear, giving them the literature on why it's important, so the buy-in, and then delineating those skills either through videotaped reviews or standardized patient discussions, and that way they can see how the skills are used and then build the core skills and then layer on top of that the more complex skills, special circumstances like delivering bad news. So then you have an opportunity to practice these things, especially if they're highly emotionally charged. You've discussed them, you've debriefed them, and then you take it back to the clinical environment where you informally watch them do this. So there's a multimodal approach that begins with having a proper structure that's in your training program, and making sure that everybody aligns to that structure, making sure that you watch your trainees at every opportunity that you have, and then using a framework by which to guide your observations, and then that is used as a way to provide formative feedback to the trainees to teach them. The other way that sometimes can work with more junior trainees is to model, and modeling can be a very effective strategy if you first prime the trainee around what it is that you want them to watch, what specific communication skills will you use during that one interaction, then going through the interaction, having the resident watch with making sure that they're watching for those skills, and then debriefing after. So that tends to work really well, particularly for junior trainees when you're first starting, and especially if the particular interaction is going to be emotionally charged.